What's going on, guys? Good evening. Make sure as you log in, you let me know you're here. Laura Pacheco, how are you? Oscar, Edgar. Blanca. 1, 2, 3, 4, 5, 6, 7. Hello. I'm good, Laura. I want to kind of make this like short and sweet because the debate is on right now, and I don't know if anyone's tuning in. Has anyone tuned into the debate? Did anyone watch like the first 20 minutes? They're already going for each other's throats, man. I think Biden told Trump to shut up, and Trump will not let Biden talk. He just keeps jamming him up. It's quite the entertaining television. But important, right? Important to watch. And I don't know. I hope you guys had plans on watching it. I hope that's something that you would tune into and try to not necessarily strengthen your opinion about things, but maybe question your opinion about things. Maybe make a final decision. I assume that most of you, if not all of you, have plans to vote. I hope that's the case. That would be a good thing, right? But anyways, let's give everyone what we got here. We got about one. Let me check on how many people we have logged in right now. Give me 1 second, guys. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay, so we're pretty close. Let's give the last couple people in the class a couple minutes to log in here, and then we'll get rolling. Okay. I'm going to pull something up real quick while we wait too. So has anyone at all, did anyone watch any part of the debate before class started? Just curious. Hold on, guys. I'm pulling something up as I talk right now. Let me get this going here. Okay. Nope. Edgar, no. Maria, Peter, no one at all. Not one person in the class was watching the debate before class started. Not one. That's troubling, guys. That troubles me a little bit. Maria, good. Kudos to you. Congratulations. You are probably the smartest person in the class. Tune in, guys. No, just got off work. Yeah, well, gotta make that money. I hope you're putting 20% aside, Laura. Yeah, well, tune in, man. You can pretty much record anything now with any TV service. If not, YouTube it and Google it a little bit later and just watch the highlights. Tomorrow morning, tune into whatever news station you watch, or I actually listen to news. I find listening to news radio shows a little bit easier to swallow than staring at some of the people who do news and watching it. But listening to some analysis, not a bad idea. Okay, educate yourself a little bit. A lot of the times when they're talking, I mean, they'll mention programs that I don't pretend to know what they are. Or they'll mention stats. I'm like, is that true? Is there really this many people with, pre-existing conditions or whatever it is? It's always good to kind of hear some analysis and do some fact checking. And it's pretty consumable. In other words, there's plenty of podcasts, news shows, news radio shows that are going to be talking about this tomorrow. As a matter of fact, they're going to be talking about it for a few days. So anyways, moving on. Last week, we talked about assessing risk, right? Assessing risk of contracting an STD. Remember, keep in mind, age is a big factor, big factor, right? Just being between the ages of 15 and 24, you're at an elevated risk. Not wearing a condom, you're at an elevated risk. Having multiple partners, you're at an elevated risk. The only two things that we talked about last week that doesn't necessarily make you at an elevated risk, they're just good to know, is have you had sex in the last 10 years and are you getting tested? Those are kind of related to your overall health and obviously sexual health, but there's not necessarily a direct correlation between STDs and testing. In other words, if you haven't been tested, it doesn't mean you're at an elevated risk for contracting an STD. It just means that it's possible that you live with one longer than you should be living with one, or your treatment is delayed. That's all that means. So anyways, tonight I wanted to quickly, because unlike you slackers, I want to get back to the presidential debate. To be completely honest with you, I think it's really important. This is kind of a crazy time, and I just want to see it. I mean, I'm recording it, but I also just want to see it live, because I know, I've already got people texting me, can you believe this? Can you believe that? Anthony's like, cool, I'm in, whatever, dude, as long as I don't have to stare at you for the next 20 minutes. I got you, dude. I got you. So anyways, I wanted to get into, I can't have it play in the background here, Maria, because I wouldn't be able to think, but I got you. I wanted to quickly talk about 3 STDs in particular, just as they relate to them being skin-to-skin transmitted STDs. There are other STDs that are transmitted skin-to-skin, but these are kind of the big ones. And for the purposes of just kind of knowing the big ones, but also kind of understanding them and that they transmit skin to skin is kind of the most thing, right? So with that said, the first one we're going to talk about is herpes, okay? And when you talk about herpes, you're really talking about 2 different viruses. You're talking about herpes simplex virus 1, or HSV1, and you're also talking about HSV2, right? So there are 2 different types of herpes, right? Herpes is a virus, obviously transmitted via skin-to-skin contact. Within 3 inches of the infected area is kind of the general consensus on area. You are at risk for transmitting said disease. Uh-oh, they're telling me my connection is unstable. All right, I think I'm good. HSV1 is basically a cold sore. It's a cold sore that primarily pops up on the lip. So I hate to say it, if you've ever had a cold sore, guess what? You have herpes. Ultimately, not that big of a deal. There's a lot of people that have cold sores. There's a lot of people that have HSV1 and they've never had a cold sore, so they'll never know that they have HSV1, right? So again, the body, your immune system will act and interact with said virus. Some people will have multiple cold sores throughout a year. Most of the time, it's maybe like 1 or 2. That's partially because HSV1 the kind of the cold sore herpes is just not as strong of a virus as HSV2. HSV2 is the herpes that primarily happen downtown, right? Genital herpes. Those have a tendency to be much more voracious, more outbreaks, and they also have a tendency to just be more numerous. In other words, a cluster of blisters or numerous blisters for an outbreak, not one blister on your lip as your cold sore. The way they determine HSV1 and HSV2 is just simply through a blood test. Obviously, if you have an open sore that appears on your lip, it's painful and it's tingling, or you have an open sore that pops up on your genitalia and it's painful, the doctor is going to say, let me see it. But to determine which one you have, it's going to be a blood test, because just because HSV1 primarily happens up here and HSV2 primarily happens down there doesn't mean it can't flip. In other words, you can get HSV1 on your vagina or on your penis or on your anus, and you can get HSV2 up here in your mouth. You can actually get HSV2 in your eyes. You can get herpes in your eyes. So keep in mind that just because it's on your mouth doesn't mean you have the weaker of the two types of HSV. So the blood test will determine that. Worst case scenario, to be completely honest with you, it's a rash. It's essentially not something to be excessively concerned about. Once you get herpes, you'll always have herpes. There's no cure. Your body will interact with the virus and primarily suppress it. There is some medication, and this is a name brand medication. It's called Valtrex, that suppresses both HSV1 and HSV2. If you're dating someone who's immune suppressed, or you're dating or married to someone who has immune issues, and you have HSV1 or HSV2, it's probably a good idea that you take something like Valtrex that helps kind of suppress the virus from popping up and actually starting the blister or starting what we call the viral shedding period, because the viral shedding period is the thing that you ultimately have to be concerned about. Why do I say that? The viral shedding period typically starts really before there's any type of indicator. Sometimes people, like let's say with a cold sore, they'll feel a small itch or maybe a tingle a little, and then all of a sudden the next day it kind of hurts a little bit, and then boom, up comes a blister. The viral shedding actually happened prior to that. And by viral shedding, I mean the virus is actively like trying to transmit. In other words, you're highly, highly contagious at that point. Throughout the sore popping up and going back down, that's continuing that viral shedding period, and you're contagious at all points of that. Not only that, when you have an active cold sore, you're highly contagious. I wouldn't even share drinks, straws. I would not avoid any kiss. I would avoid all kissing or any of that kind of stuff if someone is having like an active cold sore or even an active genital herpes outbreak. I mean, obviously, avoid that like the plague, right? You don't just because you're very, very contagious at that point. That's the viral shedding period. That's when HSV1 and HSV2 is trying to get to you or trying to move through the population. Worst case scenario. Worst case scenario is untreated herpes outbreaks. Obviously, they're sores, they're blisters, they're open wounds. And as a result of that, you are now at a higher rate of transmission for other STDs, right? So remember I told you last week, STDs have a tendency to run in groups. If you've had one, it's likely that you've at least been exposed to another, or maybe you have two, right? And that's not that uncommon. So it's not something to, go ooh or not want to think about. it's something to go get tested for. The symptoms of herpes, you'll know. There's no way you won't know at some point, but it is theoretically possible for you to have herpes now and you not know it at all. In other words, your body is suppressing it. You're never going to have a cold sore. You're never going to have a genital herpes outbreak, and you just live with it. And your body, your immune system just suppresses it. Okay. All right. So next topic. We talked a little bit about it last week. HPV, human papilloma virus. In other words, warts, right? So again, a virus transmitted through skin-to-skin contact, 3 inches of the infected area. And really something to not necessarily be too concerned about. Again, it's another thing that people deal with, all people deal with. I mean, most people have some form of HPV. In other words, most people have some form of warts. What we need to be concerned about is there's a couple of strands of sexually transmitted types of HPV that are taking over as the #1 source of cancer. And ladies, if you get a pap test, or when you get a pap test, this is exactly what they're looking for. They're looking for an abnormal result from the tissue on your cervix. That's what they're doing. They're scraping the wall of your cervix, and they're getting a tissue sample, and they're looking for cells that give an abnormal cellular structure or a mutation in the cellular structure. They know now that if that test pops up abnormal, that you have an HPV infection, and that cellular structure that's called dysplasia. It's basically what it's saying is it's precancerous, right? And let me tell you why it's so important for you to get that PAP and to get treatment. The cervix, right? So you have, excuse my gesturing here, but I don't really have like a model of, the female anatomy with me. So you have your ovaries, you have your fallopian tubes, you have your uterus, and at the bottom of your uterus, you have your cervix. Your cervix is a layered tissue, right? That acts basically as a plug. It acts as a cork, as a uterine plug. So like if we fast forward to you're pregnant and you're starting to have contractions, the contractions start roughly underneath your breast line, and they're going to start pushing the baby down towards the birth canal, right? Towards the vaginal canal. Then what happens is when the water breaks, there's a mucus plug that falls out of the cervix, and that starts what we call effacement. In other words, the cervix thins out and opens up, and now the baby's head starts moving down into the birth canal. If you have a lot of HPV infections, or like a really voracious HPV infection, what the doctors will do is ultimately they'll come in and they'll just lance that part of the tissue that's giving you problems, right? So if let's use the analogy of holding a wine bottle and you start chipping away at the cork. I mean, if you chip away at the cork enough, it's not going to hold the wine. And it's very similar with if you have a lot of issues with HPV and cervical cancer or precancerous tissue, and they're having to go up there numerous times and get rid of sections of your cervix, you are going to have, statistically, you will have a rougher time of carrying a child full term. Carrying a child full term is really, really important, because all of the really important tissues are the ones that develop last. The eyes, the lungs, the heart, the liver, the pancreas, the kidneys, all of those very important tissues that basically run your body, filter your blood, digest nutrients and things of that nature. Those all develop last, right? So carrying a child to full term is really, really, really important. Getting PAPs annual PAPs, especially once you start being sexually active, really, really, really important. Guys, for the most part, you're carriers. You might wake up one morning, look down and go, what the hell is that? And go to the doctor and like, dude, I got a bump on my, you know what? He's going to be like, let me see it. And he'll basically ask you, do you want me to burn it off? Or you want me to freeze it off? That's pretty much it. That's all they're going to do. There are cases, again, rising cases of oral cancer. Obviously, if you get oral HPV, we know how you got it, right? You know how you got it. So be careful on, who you're doing the dirty with and basically who you're going downtown with. Be conscious of that. Have that conversation with your partner. And, if it's someone that you care about or someone that you want to be with and you care about that person as a person, you're able to have that conversation, right? Okay. Last one of the night. Syphilis, okay? Another biggie. And the reason why it's a biggie is because the numbers on this are starting to rise again. For many years, the numbers in syphilis and really in all STDs were going down in America. We did a pretty good job of pushing the condom thing, educating people about wearing condoms and having, fewer numbers of sexual partners, not multiple numbers of sexual partners. And that was working, but things shifted, and that probably really reflects, the fact that, people have a tendency to have a lax attitude about sex. There's a lot of people that have sexual partners, just kind of friends with benefits, like, yeah, every once in a while we hook up kind of thing. There's obviously hookup sites. Some of the social sites, social media sites end up being hookup sites. So there's a lot going on with that. But one of the diseases that are on the rise is syphilis. And, for a long time, and statistically it still is, most cases of syphilis in the United States happen with men having sex with men. And that's not a comment on homosexual sex. I mean, this isn't a disease that only homosexual people get. There's no such thing. Men can get it from men can get it from women can get it from men, and women can get it from women. But that's just, that's where we see most of the syphilis cases. But it is making a comeback. And so what syphilis is a bacteria. Again, skin-to-skin contact when you come in contact with a sore. And the thing about syphilis is the sores are painless. And you typically only get one. So like you'll get a sore in the back of your mouth, or maybe on the back of your tongue, or maybe like underneath your penis, or, somewhere around the opening of your vagina. And it's not, if you don't see it, you really don't know it's there because there's no pain associated with it. After a while, what will happen if it goes untreated, you'll get a rash on your hands and on the bottoms of your feet. And that's a pretty good sign that you're sick, even if it's not syphilis. I mean, the palms of your hands, the tissues on your hands are probably the most resilient tissue that you have. They come in contact with billions and billions of viruses and bacteria every day. They get damaged a lot. They're constantly reproducing skin. These are your most resilient tissues. So if you show signs of issues with the palms of your hands, then you've got a serious immune issue going on. And the thing about syphilis is, if syphilis goes untreated, it will transfer to your heart tissue. It could cause heart failure, and it can transfer to your brain, and it can cause neurological damage. In other words, before we had a treatment for syphilis, which is antibiotics, before we had antibiotics, like back in the 1500s and 1600s, 1700s, if you contracted syphilis, you died of syphilis. You eventually died of a slow death, and you essentially became a healthy person, right? And then many times you lost your cognitive capabilities. You went crazy, right? You went crazy. Worst case scenario with syphilis, obviously, and same thing with herpes, to be completely honest with you. ladies, when you're pregnant, if you decide to have sex with people, I mean, have sex when you're pregnant. That's not an issue. But if you're having unprotected sex and you're not having sex with like necessarily the same person, maybe you have multiple partners, maybe you had a hookup one night, you need to make sure that your doctor knows that and talk to them about getting tested, because at the very front end of your pregnancy, you'll get tested for everything, including HIV. They'll do a pap. They'll put your legs in stirrups. They'll check out everything you got. They'll check out the size of the baby, the anatomical structure of the baby. They'll check everything. But if you're having sex and you don't tell the doctor, and you have unprotected sex, and then you have a herpes outbreak or a syphilis outbreak during the birthing process, you can transmit that to the child very, very easily. Their immune systems are not ready for that. As a matter of fact, herpes, if it gets into their eye, it can actually get into their spinal cord, and it can cause neurological damage. I mean, obviously the same thing with syphilis. If you're doing the dirty while you're pregnant, make sure that you're wearing a condom, okay? But number two, make sure that you get tested again. I mean, you're there at the doctor's office anyways. They'll do it. They do it all the time. They'll just run another STD test, do another cervical examination, check you out, okay? Okay, so herpes, HPV, syphilis, all skin-to-skin transmitted diseases, all within 3 inches of the affected area. Herpes and HPV, they're both viruses. Once you get them, you'll never get rid of them. Your body, for the most part, will suppress them and deal with it. There are some medications out there. There's actually a vaccination for HPV, and many of you might be of the age where you probably got it. I don't know. Got the vaccine, not got HPV. And then obviously syphilis. Syphilis is a bacteria. Syphilis has been around since the beginning of humans, but it's a disease that we haven't eradicated. We have a treatment for it, antibiotics, but it's not something that is out of the realm by any stretch of the imagination. Okay, that's it for the night. So guess what? You obviously have an assignment due tonight. I'm not going to give you an assignment based off the lecture. So tonight, no lecture question. I'll go into Canvas and figure out how to delete that column. If not, I'll just give everyone 5 points. I'm not worried about it. Do your homework. Go or do your assignment that's due tonight, week 7 assignment, and get back to that debate, right? Or get back to work, Laura, or get back to whatever else you're doing out there, Peter, right, and Edgar. Okay, good. I'm good. You good? See you next week.